Greetings, doctor and friends. My name is Bagus Tresna Indra Putra Pramana with the last 3 digits of student number 104. And we are from SGD 3. We would like to present our student project titled Basal Abscess. And here are our group members.
So I will explain you about the background, but before that let me introduce myself. My name is Tabitha, Etrina, Beru, Sembiring with the last 3 digits of student number 232. So basal abscess is a serious complication arising from infection of the middle ear and mastoid, often associated with acute otitis media or mastoiditis. First described by Friedrich von Basel in 1885, it occurs when infection erodes the mastoid bone, leading to an abscess in neck, typically between the digastric and sternocleidomastoid muscles. Although rare, its incidence may increase in population with untreated ear infection. A recent study showed no cases among 5 million visits from acute otitis media, highlighting its often overlooked nature. Adults, particularly male, are more frequently affected. Symptoms include neck swelling, fever, orthoria, hearing loss, and limited neck mobility. Diagnosis is primarily through CT and MRI, which can reveal mastoid bone erosion and abscess location. Basal abscess can lead to severe complications like cerebral infection and meningitis, making prompt treatment essential, including antibiotics and surgical intervention. Postoperative imaging is advised to ensure complete recovery. Understanding its pathophysiology and treatment option is crucial for improving patient outcomes.
Okay, so thank you for the opportunity. My name is Pradnya Putri, and my last 3 digit of my student number is 7. And today I'm going to explain or tell about the problem formulations, the objective, and also benefit of the student project. First, about the problem formulation of the student project are first, what is the definition and epidemiology of basal abscess? Second, what are the factors related to basal abscess? Third, how is the mechanism lead to basal abscess? Fourth, what is the examination used to diagnose basal abscess? Fifth, what are the treatment regimens used for management of basal abscess? And last one is, what are the complications and prognosis of basal abscess? Okay, so next about the objective of basal abscess is to answer the problem formulation that all we concluded before. So you can see from the slide. And the last one about the benefit of basal abscess. There are 2 types of benefit. First one is theoretical benefits, is to contribute to establishing diagnostic criteria based on clinical and imaging findings, which helps clinicians to do the early identification and intervention. Also aims to preserve the best management to the patient and give preventive measures for vulnerable populations. Second, practical benefit. This literature emphasizes the importance of educating patients and families about the sign of complications of basal abscess, improve the clinical management, and minimizes risk of future infections. Hence, this literature also can help the pre-clinicians and clinicians to improve the patient's outcomes and improve the quality of life of the patients post-treatment. Okay, so that's all. Thank you.
I will continue the presentation. Before that, my name is Mahadewi Pradnya Prashanti with the last 3 digits of my student number are 064. I will continue the presentation with definition of basal abscess. So basal abscess is a deep neck abscess and also a rare complication of mastoiditis which occurs when the infection causes erosion of the mastoid resulting in an abscess. In 1881, Friedrich Basel, a German otologist, was the first to explain about basal abscess. And the cases of basal abscess have significantly reduced since the discovery of antibiotics. There are several common symptoms of this abscess, including fever, ear pain, ear discharge, neck pain, and with or without noticeable neck swelling. Neck swelling that occurs can cause difficulty swallowing, limitation of movement, and torticollis.
Thank you for the opportunity. My name is Julyvia Gifensius with the last 3 digit registration number 088. I will now explain about the epidemiology of basal abscess. Basalt abscess is an extremely rare condition today, largely due to the widespread use of antibiotics to treat ear infections. Historically, however, it was more common as untreated or poorly managed otitis media often led to complications, including mastoiditis, which could then progress to basalt abscess. The primary cause of basalt abscess is thus linked to untreated or chronic suppurative otitis media or SOM, with mastoiditis often serving as an intermediary condition. Risk factors for SOM vary by age group. In children, these include low socioeconomic status, daycare attendance, and certain medical issues like cleft palate, craniofacial deformities, or immune dysfunction. In adults, risk is heightened in those with underlying conditions such as uncontrolled diabetes, renal failure, HIV, or other immunosuppressive states. Furthermore, limited access to healthcare in certain regions exacerbates the risk, as delayed diagnosis and untreated infections can increase the likelihood of severe complications. Age-related factors also play a role, with cases being particularly rare in children under 5 due to their lack of mastoid pneumatization and thicker mastoid walls, which act as barriers to infection spread. While cases of basalt abscess are sporadic worldwide, they are often associated with delays in diagnosis or antibiotic-resistant infections, emphasizing the need for early and comprehensive treatment to prevent this potentially serious condition. That's all from me. Thank you.
Let me introduce myself. My name is Samantha Petrona Theobald with last three student numbers 108. So let me continue the presentation. So for the pathophysiology of basalt abscess, a complete aerated and pneumatization of mastoid bone is the important component for basalt abscess. The mastoid bone dominantly consists of antral cells during the birth. Through the cells, development of air cells occurs, resulting in total mastoid bone pneumatization. The process happens at the age of 5. During the process, the walls of mastoid bone become thin, especially the end of mastoid bone. The medial surface along the incisura digastrica. In the incisura digastrica, attachment of the digastric muscles takes place. This whole process makes the mastoid bone susceptible for infection. When infection occurs, both bacteria and secretions enter the eustachian tube to the middle ear and go directly to the mastoid bone through adductus ad antrum opening. During inflammation of the middle ear, adductus ad antrum are obstructed. It causes the purulent secretion to be trapped and accumulated in the mastoid bone. The purulent substance on the mastoid bone results in pneumatized air cell, which is already fragile enough to be inflamed and death. This will thinning the wall further. The inflammation spread inferiorly to the end of the mastoid, causing the thin bone along insertion of digastric muscles to be gradually destroyed. Thus, the purulent substances will eventually spread to the area between digastric and sternocleidomastoid muscles. Prolonged infection causes the end of mastoid outer wall to be infected together with sternocleidomastoid muscles, trapezius and splenius capitis muscles.
My name is Tjokorda with Mahadewi with the last three digit number 189. I will explain about the risk factor of basalt abscess. The development of basalt abscess is closely linked to the anatomical structure of the mastoid bone and presence of the otitis media. The venematization process, which thins the mastoid bone walls, particularly at the medial surface near the digastric muscle attachment, make it susceptible to infection, and when otitis media occur, the obstruction of the adductus atrium leads to the accumulation of purulent material within the mastoid bone. This can result in osteoarthritis and osteonecrosis, further weakening the bone and facilitating the spread of infection to the surrounding tissues, including the sternocleidomastoid muscle. The risk factor of basalt abscess primarily include otitis media, immunodeficiency, delayed treatment, and also antibiotic resistance. And that's all from me. Continue with my friends. Thank you.
Hi, my name is Nyoman Virananda with the three-digit number 126, and I'm going to explain about the diagnostic evaluation in basalt abscess. So the diagnostic evaluation can be concluded with history taking and clinical presentation first. So patients with basalt abscess often have a history of automastoiditis, which may be acute, chronic, or recurrent. And the key symptoms include neck pain, swelling in the lateral neck, post-auricular tenderness over the affected mastoid bone, atalgia, otorrhea, hearing loss, and fever. And the clinical signs to watch are ipsilateral cervical swelling and tenderness around the mastoid region. Next is the laboratory examination and the radiological examination. In laboratory findings, it is commonly shown elevated leukocyte C-reactive protein or an increase in erythrocyte sedimentation rate level, all indicating a bacterial infection. And the radiological examination can be done with imaging of temporal bone CT and contrast enhanced neck CT for essential gold standard diagnosis. And MRI are considered in cases with intracranial complications for more detailed imaging.
Okay, thank you for the time. My name is Yuda, and in this next occasion, I would like to add some point about the diagnostic evaluation in basalt abscess. Basalt abscess is a rare but serious complication of mastoiditis caused by infections penetrating the mastoid cortex and forming a deep neck abscess. Its gradual onset with symptoms like neck pain, swelling, ear discharge, and hearing loss make diagnostic challenging. CT and MRI are critical for detecting mastoid bone erosion and related conditions, such as cholesteatoma. A study of 97 cases showed it can occur at any age, with adult males more commonly infected, often following otitis media. Early diagnostic and surgical intervention are essential to prevent the infections from spreading to the mediastinum or brain. That's all from me. Thank you. For the next speakers, the time is yours.
Good afternoon, my name is Philbert Purbowo and the last three digits of my name is 148. The management of basalt abscess is the usage of broad-spectrum antibiotics via intravenous administration. Now, after antibiotic therapy, a contrast-enhanced CT scan is used to identify the fluid collection. And if fluid collection is identified, then surgery drainage via transcervical approach will be done. However, if a coalescent mastoiditis is found with the fluid collection, then the incision will be done via post-auricular, with an addition of complete mastoidectomy. During the procedure, the damage to the nerve must be avoided, and if another case with concurrent suppurative OM is identified, it is required to place a tympanostomy too. Some cases may require a post-auricular superior linear incision instead of the standard post-auricular incision because of the possibility of a more superficial facial nerve position, and this is usually present in children because the mastoid aerosol system is not yet fully developed yet. The drainage procedure itself is done to drain purulent material and remove granulation tissue. And after the drainage, a broad-spectrum antibiotics treatment with good cerebrospinal fluid penetration must be continued until further tests shows that it is no longer required. This is done to prevent inflammation of other vascular structures. That's all from me. Thank you.
So, hello everyone, my name is Adellya Pramesty with my last 3-digit number 165, and here I am gonna explain about the complication of basalt abscess. As per definition, basalt abscess is an ENT problem arising through the drainage of pus in a mastoid process, constructing a suppurative collection. Basalt abscess complications come out to be the consequence of intracranial spread. This intracranial spread is life-threatening and increases the chance of head and neck sequelae. If this is untreated, basalt abscess will cause problems in sigmoid sinus, transverse sinus, and meninges, which are the area of its spread. Infection often affects the deep fascia of cervical, mainly the jugular vein. Basalt abscess that compresses the internal jugular veins is known to relate with sidelong lateral sinus thrombosis. Furthermore, lockjaw or trismus and superficial extension are also conditions that are commonly found alongside the deep fascia. As a matter of fact, it also can lead to mediastinum influx, causing acute mediastinitis. When affecting the mediastinum, mortality rate could reach 70%. Moreover, in long-term neglection, basalt abscess may lead to meningitis, cranial neuropathy, hearing loss, and death.
Thank you, Dr. and Director, for the time that given to me. Let me introduce myself. My name is Komanchan Ragananda with last three digit number is 091. So in this section, I will explain about the prognosis of basal abscess. So the prognosis of basal abscess is strongly influenced by early diagnosis, underlying health condition like and timely effective treatment. The basal abscess developed as complication of chronic rhinitis media, presenting with symptoms like ear pain, swelling, fever, and potentially neurological signs if infection spreads. The early treatment with intravenous antibiotics and mastoidectomy is essential for symptom relief and preventing complications, leading to favorable outcome for most patients. The differential diagnosis include conditions like lymphadenopathy and infective bronchitis, which may mimic basal abscess but can distinguish by imaging this technique. That's all from me. Thank you.
For the conclusion of our student project, basal abscess is a rare, serious complication of mastoiditis where infection spreads from the mastoid process to the neck, risking mediastinitis if untreated. Symptoms include fever, ear pain, neck pain, and sometimes swelling. Though now uncommon due to modern treatment, basal abscess can occur in adults with untreated infections and compromised immune systems. Key risk factors include otitis media, bacterial infections, and medical conditions affecting immunity. The condition can develop when infection from the middle ear and mastoid cells cause bone erosions, allowing pus to spread into surrounding muscles. Diagnosis involves patient history, physical exams, lab tests, and imaging. Particularly CT scans to confirm abscesses, boundaries, and mastoid erosion, with MRI for assessing possible intracranial issues. Treatment typically includes IV antibiotics, CT-guided drainage, and potentially surgery to remove the infected tissue. Without timely intervention, the infection may lead to severe complications like intracranial spread, lateral sinus thrombosis, and even death. Prognosis is favorable with early treatment, but delayed care increases complication risks. Underscoring the need for prompt management and follow-up is also necessary. So that is all from SGDP 3 for our student project presentation. Thank you for your attention.